one through.
Oh my god, it makes me laugh. It's like, first comment. Medical injuries in a magical land full of frog people? What? Listen, I've never seen it, but a lot of you have suggested it, so today we're reacting to Amphibia. Alright, let's dive right in.
Ow. Ow.
Smacking your hand against the metal object. You know, you could get just normal hematomas, contusions, basically little bumps and bruises. They will typically go away on their own. Falling out of a large building, anytime it's 3 times greater than your height, it is a major fall, and that's actually indications to go to a trauma center. Burritos. Ouch!
Ow! Careful! Pretty sure those ticks cause internal damage.
Nice! Honey is actually really good. It decreases inflammation, has natural anti-inflammatory properties. So that's a lot of tick bites if she actually got bitten by ticks. Here in the United States, we worry about deer ticks and dog ticks. The smaller ones are the ones that potentially cause Lyme disease, ehrlichiosis, babesiosis. These are tick-borne illnesses.
Friend punch! Ow! Hey!
Caught thief!
When people actually fracture the nasal bone, it doesn't get displaced or shifts. It actually just cracks on either side. If it is causing disfigurement, then it needs to be, put back. One for anatomical alignment, and the other is so you don't have deviation internally, which then will lead to difficulty potentially breathing through your nose.
Are you guys okay?
Just a little dehydrated from the heat.
Being hot, you can easily get dehydrated, not just from sweating, but actually even breathing. When you increase the amount that you're breathing, you're actually breathing off water as well. You don't realize it as much. What the heck is this guy? I don't even know what this is. Big rolling balls.
The gravity's too much. I can't move.
This could be similar to when you actually go like super deep into the ocean. The forces down there are even pushing on and causing compressive forces to your body and doing a lot of different types of potential damage.
And the best part, but beware, their stingers cause paralysis.
Nice! Sometimes you can get bitten by a tick and it causes tick paralysis. And when you remove the tick, it actually goes away. Oh my gosh, so if you get hit on the lateral aspect of the knee, which is very common in football injuries, you can injure your ACL, MCL, and your meniscus. When it hits laterally, it actually opens up the joint on the medial aspect or the inner aspect of the knee. Ouch! The best way to fall is like basically tuck and roll versus putting your hands out and with an outstretched arm, because that's where things fracture and break super easy versus like tumbling and keep things tight in.
Where are you? You won't pay for this.
So that's like what we would call a Lafort fracture. So if somebody gets their face smashed in the front, there's different grades of Lafort fractures, and just has to do with like displacement area of where there's fractures to the face.
First one through.
Oh my god, it makes me laugh. It's like, first comment. Whoa. Oh man, it looks like he probably fractured or broke his wrist. Typically, when you punch somebody, you'll have a boxer's fracture if you do cause a fracture. Hitting with the weaker side of the hand, fracturing your metacarpals over here.
The box!
Percy, hurry! I just need to...
Oh! No! That injury, straight through the back, probably hits the heart. Most vital organs are caged in our chest, which is all surrounded by bone to protect us, right? But if you puncture the heart, you're putting a hole in one of the chambers, right? We have 4 chambers of the heart. Then the blood's just leaking out. Oh my gosh. Bird, go away. Look at what are those things? Typically, they don't just chomp, chomp, chomp and like kill you that way. They will drag you in the water and actually like drown you, flipping you over, that sort of thing. And then they'll eat you. Oh, what is that? That looks like a scorpion / crab. Have you guys ever been bitten by like a real something? Not like a mosquito or an insect or anything like that, but any like crazy animals? Let me know in the comments.
We're gonna
Whoa.
win! We're gonna win!
What is this? They're riding like the most massive bug ever. We'll get people who come into the emergency department who are concerned that they inhaled smoke or were around the fire. Typically, we'll end up checking what's called a carboxyhemoglobin level. We'll do an ABG, which is an arterial blood gas. And then we'll also potentially get an x-ray just to take a look at the lungs and then just watch you, see how your oxygen does.
Well, that didn't feel balanced.
What? Why is she getting electrocuted? Oh, they're all getting looks like lightning. Holy cow, super cool. When people get electrocuted, there's a chance that your heart could stop. So you gotta start CPR and then you wanna defibrillate them if you can, if there's an AED around. And the other things that can occur end up being like muscle breakdown, burning of the tissue, kidney damage, kidney failure. Whoa! Whoa! Using like magnifying glass or some sort of lens and you're actually having light come in, you can really injure somebody.
Whoa, you frogs are really flexible, huh? Are you sure you know how to massage a human?
Is same.
Oh my gosh, jumping on somebody's back indiscriminately, bad idea. You can break things, you can actually cause herniation of discs in the back. Oh my gosh, it's the longest set of stairs. Oh, if you fall down a flight of stairs, please get checked out because sometimes your adrenaline kicks up. You don't know if you have an injury. A simple x-ray will help figure that out. So, get that pull up. Get it.
Honey, be careful.
If you're straining that hard, put a chair there and help yourself up gently. You know, take some of your body weight off. Or they actually have these like pull-up bands that you can use that can be helpful. Oh my god, anybody have like tape or bandage on their skin and somebody tries to take it off very, very slowly? Ouch, just rip that bad boy off. That's what we do and then the pain's over. It's easier if somebody else does it than yourself.
Little impatience, don't be impatient.
What the heck was that? If you have a loss of consciousness, you need to get checked out at the hospital. Sometimes, depending on your age, we'll either watch you for an extended period of time or do a CT scan of your head to make sure that there's no bleeding in your brain, basically, or around your brain. Very interesting. I've never seen this before. I didn't know what I was getting myself into. I think I want to see more. I want to see more injuries that are relatable, that I can discuss and kind of pull it into what I do on a daily basis. If you guys really enjoyed this, binge watch this series right here. And as always, please make sure you subscribe, turn those bell notifications on, and hit that like button for me. Thank you so much for watching, and stay healthy, my friends.